Okay, so again, to use the MyoTool for self-mobilizations of the cervical spine, we're going to show you the most basic technique, and that's unilateral PAs of the facet joints. Now this is perfect for people that have restricted rotations in the neck, difficulty driving, and you doing functional tasks that require rotation. Go ahead and grab the MyoTool and put it in the neck. There we go. And so we're going to first start with the MyoTool at the upper cervical spine. We use a pillow and the patient lies on the floor. Okay? So she's going to put it into a high position with her hands there so it rests in there nice and gently. And then the technique, let's say she has restrictions and pain on the left side of the neck and she wants to improve mobility. She may first put the MyoTool so that the knobs are and the angle of the eyeballs. And then she'll rotate the head to the left, just 15-20 degrees of left rotation. And now the left hand is going to push up towards the ceiling. And you can see with this rocking motion of the MyoTool, the two center knobs are straddling the spine, and it's creating a mobilization technique, and in this case of C2-3 area. If she changes the orientation towards her nose or her mouth area, that may mobilize C3-4 facet joints. And then again, if she mobilizes it by facing it down towards the sternum and going in this direction, then she's affecting, again, a little bit lower. So to see what that looks like on a spine, go ahead and sit up, this is what we see. We see the facet joint being treated by doing slight rotation. So here's a spine in slight left rotation. The patient's hand on the MyoTool lifting towards the eyeballs. You can see that we're at, there's C2-3 getting treated. And just by changing, by lifting on and off, we're treating tissues over that facet joint, which will impart mobility on those facet joints. C3-4, just again, the angle towards the chin, and C4-5 going towards the sternum. So having the MyoTool in the upper cervical spine can create mobilizations at approximately 3 different levels. To get the next level lower, we bring it down slightly, and the same process occurs. The same process occurs if we wanted to improve right rotation of the cervical spine. The neck goes low, the MyoTool stays high, and then you mobilize by lifting on the other side. Now, to show the next technique, go ahead and lie on your back. The lower cervical spine, we're going to bring the pillow lower, and she grabs right there. And now she may use the MyoTool, I'm going to pull your hair the other way, right there, to just do a rolling technique. So this is the other technique, to roll it up and to roll it back. It's doing like a deep, soft tissue massage of the cervical paraspinals. And she's going to mobilize that and work the CT junction. And you can see, let's go lower to the CT junction right there. Right here, just a little bit of movement needs to occur to create mobility. And as you notice, we want to try to keep her head in a good neutral position. Maybe even build up the bottom a little higher so that we can create specific spinal mobility.